Good afternoon everyone. Today's our topic is permanent mandibular central incisor. These teeth are centered in the maxilla, one on either side of the midline, and the mesial surface of one contact with the mesial surface of other. They are total 2 in number and slightly larger in dimension than the maxillary lateral incisor. These teeth supplement each other in functions and anatomically they are similar. The major function of these teeth are punch and cutting the food material during the process of mastications. These teeth have incisal ridge or incisal edge instead of cusp that is present in the canines and posterior tooth. All the incisors have a great importance in aesthetics and phonation. If the anterior tooth are missing at an early age, maxillary central incisor, then the patient may have problem in phonation. The numbering system, in the universal system, the permanent maxillary central incisor of right side is given number 8, whereas the left one is given number 9. In sigmoid power it is given 1 1, and in the Upadhyay system right one is given 1 1 and the left one is given 2 1. The average dimension of tooth in millimeters, the length of the crown is around 10.5 millimeter. The root length is 13 mm. The mesodistal diameter of crown is 8.5 millimeter. The mesodistal diameter of crown at the cervical line is 7 mm. The labiolingual diameter of crown is around 7 mm, whereas the labiolingual diameter of crown at the cervical line is 6 mm. Whereas the curvature of cervical in mesial is 3.5 mm and it is distally 2.5 mm. Then the chronology, the first evidence of calcifications occurs at the age of 3 to 4 months, whereas the crown is completed at the age of 4 to 5 years. Eruption occur at the age of 7 to 8 years and the root is completed at the age of 10 to 11 years. Now the different aspect, first of all labial aspect. When we see the tooth from labial aspect, the crown outline is trapezoidal and the shortest of uneven side are present towards the cervical line. The labial surface of crown is usually convex, especially toward the cervical third. Sometimes it may become flattened at the middle and incisal third. The mesial outline of the crown is straight. Here you can see the mesial outline is either straight or sometimes it may be slightly convex, and the crest of curvature of this outline which represents the contact area approaching near the mesio-incisal angle, which is a sharp angle. You can see here the mesio-incisal angle is sharp one. The distal outline of the crown is more convex than the mesial one, and the distal incisal angle is comparatively rounded. You can see the distal outline is rounded, whereas the mesial is straight, and here the crest of curvature is slightly higher toward the cervical line when we compare it from the mesial one. The disto-incisal angle is a rounded angle, whereas the mesio-incisal angle is a sharp. Here the disto-incisal angle it is rounded, and this is mesio-incisal angle which is sharp 90 degree. The incisal outline is usually straight and regular in the mesio-distal direction. The cervical outline of the crown, follows a semicircular direction and the curvature is towards the root wise. Developmental depressions, 2 developmental depressions are present on the labial surface. They are straight shallow depressions which are known as mesolabial and distolabial. Developmental depression extended from the incisal edge towards the cervical line. These are 2 developmental depressions and actually they represent division of 3 labial lobes. These are 2 developmental depression, distolabial and mesolabial developmental depression, and these are 3 lobes, 3 labial lobes, 1, 2 and 3. The lingual aspect, the crown from the lingual aspect outline has reverse that is present on the labial aspect. The outline of cervical line is similar, that means it is semicircular in shape, and immediately below the cervical line a smooth convexity is present, and this convexity is known as cingulum. Between the marginal ridges and cingulum a shallow concavity is present, and this concavity is known as lingual fossa. So the boundaries of lingual fossa, mesially it is bounded by the mesial marginal ridge, distally it is bounded by the distal marginal ridge, incisally it is bounded by the lingual portion of the incisal ridge, and cervically it is bounded by the cingulum. Sometimes developmental grooves may be extended from the cingulums into the lingual fossa. The mesial aspect, when we see the tooth from the mesial aspect, the crown has wedge-shaped or triangular shape, the base of which is present towards the cervical line and apex is present towards the incisal edge. When we draw a line from the crown and root in the center portion, then it bisects the incisal edge and root apex both in the middle part. So we draw a vertical line, it bisects tooth and present almost in the center of the root apex and the incisal edge. Lingual outline, when we see the tooth from the mesial aspect, then we can see that the lingual outline is S-shaped. It is initially convex in the cervical third where cingulum is present. In the middle part it becomes concave, and again in the incisal part it becomes convex, whereas the labial outline is entirely convex from cervical line to the incisal edge. Cervical line, the cervical line mesially curves towards the incisal to a noticeable degree. It is around 3.5 mm. This is cervical line, it has curvatures towards the incisal edge. The contact area on the mesial side is present at the incisal third. Here the contact area is present. Distal aspect, the distal aspect is very similar to the mesial aspect. It has certain differences. These are, first, distal surface is generally smaller than the mesial one because of the smaller bucco or incisor-cervical dimension than the mesial one. Here the dimension is slightly shorter than the mesial one. The distal surface is comparatively more convex than the mesial one in the incisor-gingival direction. The curvature of cervical line is also comparatively less than the mesial one. It is around only 2.5, where it is present 3.5 mm on the mesial side. Because the tooth contact distally with the lateral incisor, so the distal contact area is comparatively smaller than the mesial one, and it is present at the junction of incisal and middle third instead of incisal third. The incisal aspect, when we view the crown from this aspect, it superimposes on the root entirely so that the root is not visible from this aspect and the crown appears triangular in shape. Here it is appears triangular in shape, and the labial surface is comparatively broader than the lingual surface. The labial surface forms the base and the apex is directed toward the cingulum. The labial surface of crown is relatively broad and flat in comparison to the lingual surface, especially towards the incisor. Here you can see the labial surface is broader and it is lingual surface which is comparatively narrow. The outline of lingual portion tapers evenly towards the cingulum. You can see this is lingual outline which is tapers towards the cingulum. Crown of this tooth shows more bulk from the incisal aspect when we compare it from the mesial or distal aspect. The labiolingual dimension of the crown is around 2/3 of that present on the mesodistal. So the mesodistal is comparatively more, and around 2/3 is present on the labiolingual side. Now the root is single, it is conical in shape and relatively straight and tapers to a rounded apex. You can see the root is evenly tapers toward the rounded apex. When we take a cross section of the root near the cervical line, then it shows a triangle which has rounded corners. It is rounded triangular outline. Normally the root is wider at the labial side than the lingual. So you can say root is wider here, labial, and lingually it is comparatively narrow. So the base is formed by the labial surface of the triangle and apex is formed by the lingual. But when we take a mid-root cross section, then instead of a triangular shape, it is somewhat ovoid in shape. Here you can say it is mid-root section. It is not triangular. It is comparatively ovoid in shape, and it is wider in labiolingual direction than the mesodistal direction. So this is all about the permanent mandibular central incisor. Thank you.